So the SIMM study is the survey of integrative medicine in myeloproliferative neoplasms. And I think it's really exciting because integrative medicine is truly a new subspecialty that's arising. And the definition truly is a fusion of alternative complementary therapies with evidence-based standard of care medicine. And within the myeloproliferative neoplasm population, we know that although we now have JAK inhibitors, which are very efficacious for management of splenomegaly, hematologic disease control, there's still an unmet need for management of their symptoms. And so it's really a beautiful kind of merriment in the integrative medicine application for these patients. So our question was, will integrative medicine therapies, different modalities, be associated with a lower total mean symptom score on the NPN symptom assessment form, which is a newly validated measure that truly gives us a great outcome tool to ascertain if the patients are having a higher or lower symptom burden. So we asked patients 858 surveys of 80 questions apiece. What kind of integrative medicine therapies are you currently utilizing? And then also asking them several outcome measures, including the NPN symptom assessment form that I had mentioned, but also looking at measures of fatigue via the brief fatigue inventory, and depression via the patient health questionnaire PHQ-2 form, which is the shorter form, and then a single quality of life assessment question. And what we found is that there's a lot of patients that are truly already utilizing integrative therapies. And the most common was aerobic activity, with about half of the correspondents, 442 patients, utilizing aerobic activity. Secondarily, it was massage, then yoga, then nutrition, and then finally strength training, a different kind of exercise. So those were the top 5. And then there are several more, including chiropractic, breathing exercises, support groups. And what we found when we looked at overall that aerobic activity, massage, strength training, breathing exercises, as well as support groups were associated with lower total symptom scores, which is very interesting. And then we looked at subgroup analysis, looked at just the ET patients, the PV patients, and the MF patients, and were there differences in their total symptom scores and the kind of integrative modalities that they're responding to. And yes, there were. In fact, in the PV and ET patients, it truly was the aerobic exercise, the massage, and the strength training that made big impacts in their total symptom score, while in the myelofibrosis patients, it really was breathing exercises and support groups. So this gives us a lot of good information. Certainly does not prove that they're effective therapies, but it gives us good information to kind of start designing our intervention trials. And so that moves us into MPN Yoga. And so this was actually, this started before we even began the SIMM study. We were interested in yoga because a previous analysis did reveal that about 63% of NPN patients were already utilizing yoga. And there's good data in other types of tumors, particularly within breast cancer, that yoga is a very efficacious symptom management tool. And so we did design a feasibility study looking at NPN Yoga, which was online, which is streamed, where patients can be doing it within their homes. And for us, that felt like a very good fit for NPN patients because very often they travel to their hematologic kind of referral institutions. And so trying to do an on-site intervention was challenging in that patient population. Also, within the NPN group, we know that they're very socially media engaged. They love to be online within their forums, and so it's very easy to kind of recruit them, engage them in these online kind of studies. And so what we found in the feasibility study is that patients very much enjoyed having the intervention. It was feasible. They were completing it on average 60 minutes per week, and then it did decrease their depression scores, their anxiety scores, and their fatigue scores. And so this was structured as a very small feasibility study, only 30 patients. And now we're moving it into a different phase, another feasibility study, where we're then pairing it with biomarkers. And we're looking at tumor necrosis stimulus factor alpha as well as interleukin 6 and the impact of yoga on these kind of serum biomarkers, which is really exciting. And it's actually nearing completion, and we're going to marry these two feasibility studies and perform a large randomized clinical trial. And so very excited about the future of NPN Yoga, but also other integrative medicine modalities. Not just yoga, but there's another type of, it's called ACT therapy, which is acceptance and commitment therapy, which is a blending of psychotherapy with a mindfulness kind of meditation. And so that's another pilot trial that we have at Mayo Clinic, Arizona. There's also a nutrient study looking at the role of diet in NPNs. And then coming from the SIMM study, looking at breathing exercise and support groups as being very powerful symptom management techniques in myelofibrosis, which is very, very difficult to treat. They have very heavy symptom burdens. I think it's phenomenally interesting, and I'm excited to design something focused on breathing and support for that group.